Gait is basically a forward propulsion of the body with minimal energy expenditure. It starts from the heel strike and ends on the heel strike when the foot contacts again. Normal walking is 2.5 to 4 miles. The gait consists of stance phase and swing phase. The stance phase consists of 60% of the gait cycle, and this means foot is contact on the ground. It has initial contact, foot flat, mid stance, heel off, and toe off. The 40% of the gait cycle consists of swing phase, which consists of pre-swing, mid-swing, and terminal swing. This is the time when the foot is not on the ground. The gait has some prerequisites, and these are: number 1, stability in stance phase, adequate foot clearance, adequate step length, appropriate pre-positioning during swing prior to heel strike, and energy conservation. Regarding some definitions, a step is distance from initial heel strike off to the alternative feet striking the ground. Stride is distance between the heel strike of the same foot. Cadence is number of steps per minute. And foot progression angle is angular difference between the foot axis and walking direction. Regarding the foot, there are 3 rockers. First is heel rocker, second is ankle rocker, and third is forefoot rocker. Heel rocker means when the heel strike. Heel work as a fulcrum. Hip extensors contract at this time and stabilizes the hip. The quadricep contract eccentrically, stabilize the knee. Tibialis anterior also contract concentrically to control the plantar flexion. At this moment, ground reaction force is posterior to the ankle. Then is ankle rocker, which is mid stance. At this moment, tibia moves forward on the flat foot. There is increased ankle dorsiflexion slowly. The tibialis anterior is relaxing and the gastrosoleus is contracting eccentrically. Hip extensors and quads are going concentric contraction with knee in extension, and the ground reaction force is anterior to the ankle. The foot rocker, the hip is extended. The toes are dorsiflexing. The gastrosoleus is contracting concentrically. And there is propulsion and moving forward. And foot is acting as a fulcrum. So in heel rocker, which is first rocker, there is contraction of hip extensors. Quads is eccentrically contracted and tibialis anterior is also eccentrically contracted. In the ankle rocker, the tibialis anterior is relaxing and the gastrosoleus is contracting again eccentrically. While in forefoot rocker, the gastrosoleus is contracting concentrically. Regarding the gait abnormalities, number 1, foot drop gait or steppage gait. In this gait, tibialis anterior is not functioning. There is weakness of dorsiflexors of anterior compartment. This can happen because of peroneal nerve injury or sciatic nerve injury. It can happen because of stroke as well in tibialis anterior rupture. In this gait, there is increased hip and knee flexion to avoid foot being in contact on the ground while in the swing phase. And the patient slaps the foot on the ground instead of controlled motion of the foot. Crouch gait is a gait which happens in CP. The hamstrings are tight and the patient is possibly walking with a toe walk. Stiff ankle gait is a gait in which there will be no rockers. The 3 rockers will be absent.